Okay, we're gonna do trach care and trach suctioning today. The first skill is gonna be trach suctioning. My patient's elevated, the head is raised appropriately. We have a form of communication if something were to happen. So we're gonna work on suctioning. So first thing I need to do is drape my patient. Okay, and while I'm getting set up, I'm gonna hyperoxygenate my patient. It's important that I'm watching their vital signs through this whole thing to see how they tolerate it. Okay, I'm gonna take out my sterile gloves and my little thing. Okay, I'm gonna set up my suctioning. I'm gonna turn it on. I'm gonna put it between 80 and 120, keeping it in the yellow. Okay. So now I'm gonna put my saline solution that's gonna lubricate the suctioning tube inside this cup, and I'm gonna put my gloves on. Before I put my sterile gloves on, I'm gonna remove the oxygen since that's not sterile. Gloves, maybe. Maybe not.
Just eat them. Eat them.
Okay, we're gonna pretend I'm putting on my sterile gloves and put on these regular gloves that are my size. I can send you my sterile glove checkoff video if we're worried about my technique. First semester. Okay. So he's been hyperoxygenated. His stats are fine to try to suction for the first time. I'm going to establish which one of my hands is going to be my clean hand and which hand is going to be my dirty clean hand, which one's going to be my sterile hand. I'm not touching it. This will be my dirty hand. Hook it up to suctioning. This hand is going to be my sterile hand. I'm lubricating the tube. On insertion, it's 1 to 2 centimeters or until I feel resistance. You do not suction on the way down. Okay, on the way back up, you're intermittently suctioning and twirling, no more than 5 to 10 seconds. Between each time you can do it, you will be hyperoxygenating your patient, and you can do it up to 3 times as patient tolerated or as needed. When you're documenting after you are finished, you are documenting the secretion, color, amount, odor, how the patient tolerated it. If they needed more, you come back for more. When you're done with the tubing, you would still connect it so you could rinse the inside of it and have your clean and dirty hand and rinse it out. And then you could keep it in this little thing. In between, you'd always hyperoxygenate, document. So now I'm going to be doing the next skill, which is trach care. So for trach care, you'll start off with a clean glove situation and move into a sterile glove situation. So for the patient, I'm gonna have him draped just as before. I'm hyperoxygenating my patient. I can open this. All my supplies are out of the way, so I am able to place both my solutions in. I'm gonna take out that, I'm going to put in the saline, normal saline, and I'm gonna put in hydrogen peroxide. My patient has been hyperoxygenated, good to go. I'm removing the oxygen, setting up my thing here, putting on my clean gloves. We still have our form of communication if he gets uncomfortable at any time. At this part, since it's just clean, I am removing the gauze or the split gauze that's already in there. I'm documenting if there's any color, odor, drainage, all those things, throwing away. The next thing I'm taking out is the piece that's inserted. What's it called? Cannula.
Inner
Cannula. This one is one that you need to clean. It's not disposable. Guys, okay. Don't come out, please. So these are ones you wash to put back in. For now, I'm going to leave it in the hydrogen peroxide for it to clean. I'm done with my clean procedure. So now I'm going to switch to sterile. Garbage can. Okay. Move this over a little bit. Come on. Open this first. I'm going to try again. Here I go.
better person than me.
I'm gonna try again. Okay, sterile gloves, here we go. I'm determined to get one pair on today. Is this sterile? Okay, got one. No. Yes.
Oh, yeah.
Okay, my sterile gloves are on. I can set up my sterile field. Throw it away. Okay. This is sterile, but I'm still gonna be careful. I probably should have set this up before I put my sterile gloves on, but we're just gonna go with it. Okay. So my sterile field, I'm gonna set out some things I'm gonna need on it. So I can be organized. Okay. So now I'm gonna take the inner cannula and I'm going to clean it. Inside, outside, all the crust and buildup. Cleaned. After it is cleaned, I can throw this thing away. You can either dry it now with the pipette or gauze, but it needs to sit in a normal saline solution to clean off the hydrogen peroxide. While it's sitting in there, I'm going to take my Q-tips. I don't know what they're called. That's a brand name. That's fine. And the hydrogen peroxide, I'm gonna clean the top and bottom.
It's a cotton swab. There it is.
Cotton. I told you Q-tips is not the word. Cotton swab. Clean the top. Throw it away. Underneath. Throw it away. At this time, I will take since I'm still sterile, take my inner cannula, dry it off, pipette, gauze, sterilely put this back in. Get in, please. Push it in, it's locked in, secured. Now, I'm no longer gonna be totally sterile because I'm gonna have to shove my hands up in there. Taking my new piece of gauze, putting it under the plate, around the trach, with care. Okay, it's in there. Okay, now I would take the tie undo it and put the new one, just verbalizing it. And after I'm done, I make sure I would hyperoxygenate, document how the patient is tolerating it, make sure there's extra supplies that are needed in the room for emergency purposes. Yeah, I think I'm done.